the SRS Training and Education Department. My name is Meg Murphy, and I will be your instructor today. And along with me today, we have Lynn Mayshow, who will be our tech person and also helping me answer any questions that all of you may have. So we ask that you, if you have a question, if you put it in the chat, that will be very helpful. And then if I'm talking or if I ask for questions, you can go ahead and take your self off of mute and ask the question. But this is definitely your time to get all of your answers, your questions answered. Okay. All right, so let's go ahead and get started with the content. All right, so here are our objectives. We're going to review steps of medication administration to ensure that we safely administer the flu vaccine. We will discuss IM injections for both adult and pediatric vaccines, review safety concerns that are associated with IM injections, demonstrate in practice, well, we won't be practicing, but we'll be showing you a video on pediatric restraint techniques. And we'll be reviewing the flu vaccine formulations that are for the 2020-2021 season. We'll be discussing proper vaccine storage, and we'll review the 2020-21 flu paperwork and resources. Okay, let's start by talking about the annual flu burden. Last year from flu season, October 1st, 2019 through April 4th, 2020, the CDC estimates that there were 39 to 56 million flu illnesses, with 18 to 26 million flu medical visits, 410 to 740,000 flu hospitalizations, and 24 to 62,000 people in the United States died from the flu. So as we go into flu season, things are much more complicated this year because we are dealing also with COVID. So we want to decrease this annual flu burden because we are going to have an increased burden on our hospitals and clinics due to COVID. Okay, and then medication and vaccine errors. This is another thing we want to point out to everybody, that there are a lot of errors at Sharp Re-Stealy with vaccines and medications. And as you can see from this pie chart here, June 2018 through August 17th, 2020, so just less than a month ago, Sharp Re-Stealy had 73 vaccine errors or near misses, and 56 non-vaccine errors or near misses. Our goal is 0 errors, vaccine and medication, and 0 near misses. So we need everybody working together to help this happen. And we do have a history of several flu vaccine related errors at Sharp Re-Stealy in the past several years, and we were hoping to have no errors this year. We also have needle stick injuries. So you can see we have data up here from 2018 through 2020. And the blue indicates errors, needle stick injuries that occurred during patient movement. The yellow orangey is during administration, and the green is after administration. Okay, and that bright green is during activation of the safety device, which we didn't have any for 2020. But we did have 4 needle stick injuries related to patient movement, which is why we're going to be showing you how to properly and safely restrain our pediatric patients, because they are the biggest risk for us getting a needle stick injury, just because they don't like needles and they move, and that's when needle stick injuries occur. We had 2 needle stick injuries that occurred after administration in 2020, and we had 2 needle stick injuries that occurred during the administration. Okay, so let's talk about now who can get the flu shot. Anyone who is age 6 months of age and older is eligible to receive the flu shot. Pregnant women are eligible to receive the flu shot, and they should receive the flu shot. It is safe for them to get it, and we do not want to be having flu complications in a pregnant woman. And then people with chronic health conditions also are eligible to get the flu shot and need to get the flu shot to decrease morbidity and mortality in this population. We have several different flu shots that are approved for people of different ages, and we have a flu vaccine grid that we'll be showing you in a few minutes that describes this. All right, and everyone needs to get a vaccine that is appropriate and FDA approved for their age. There are certain people who should not get the flu shot. Okay, children younger than 6 months old should not get the flu shot. It has not been FDA approved and has not been proven safe for them to get the flu shot. So we need to wait till they are 6 months old. And then people who have severe life-threatening allergies to the flu vaccine or any of the ingredients in the vaccine should not receive a flu shot. Okay? And we'll be talking in a moment about egg allergy and how that plays into eligibility to receive the flu vaccine. Okay. All right, so egg allergy. If a patient's reaction when they are exposed to eggs is hives, it is okay for them to receive the flu vaccine. If their reaction to eggs includes angioedema, respiratory illness, lightheadedness, recurring emesis, or have required epinephrine or emergency medical intervention when they've been exposed to eggs, it is still okay for them to receive the flu vaccine, but they do require monitoring. And for this specific population, it needs to be administered by their primary care provider in the office where they can be properly monitored and not in one of our flu clinics. Okay. If someone has had a severe allergic reaction to the flu vaccine, then they should not receive future doses of the flu vaccine. There are certain people who need to talk to their physician, before getting the flu shot. Okay, and they can decide along with their physician if getting vaccinated is the right decision. This includes individuals who have the allergy to eggs or an allergy to any of the ingredients in the vaccine. If they have ever had Guillain-Barré syndrome, for those of you not familiar with this, it is a severe paralyzing illness. And these individuals should not get the flu vaccine if they have a history of this. If an individual is not feeling well, before we give them the flu vaccine, they need to discuss their symptoms with their doctor and then make the decision if they should get the flu vaccine now or wait until they're feeling better. All right, let's talk a little bit about COVID and influenza, and this information is from the CDC. This year, as I mentioned at the beginning of this class, flu vaccination is extra important for this upcoming flu season. We need to help reduce the overall impact of respiratory illness in our population, which will decrease the burden in our clinics and also in the hospitals. Okay, because right now we have an increased burden due to the COVID-19 pandemic. So we are going to be offering flu vaccines to all of our members. Our goal is to vaccinate as many of our members at Sharp Reese-Dealey as we possibly can this year. Okay, a question. Should a flu vaccine be given to someone with suspected or confirmed COVID-19? The answer is no. We want to postpone this for these individuals who have a suspected or confirmed case of COVID-19, regardless if they are symptomatic or asymptomatic, until they have met criteria to discontinue isolation. What this does is avoids exposing healthcare personnel and other patients to COVID. All right, and patients are going to be screened on either entry to the clinic or the flu clinic for COVID symptoms, and they will not be allowed to proceed if they do have COVID symptoms. And then keep in mind that giving vaccines is not considered an aerosol generating procedure. Therefore, you do not need an N95 or higher level respirator to administer the flu vaccine. our recommended PPE that we have available and we require you to wear, that it was in alignment with the CDC, is gloves, a standard mask, and eye protection. All right, and all influenza vaccines for 2020, 2021 are preservative-free and come in single-dose manufacturer-filled syringes. This is great news because it is in compliance with the California thimerosal law. For those of you that aren't familiar with thimerosal, it is an ethyl mercury-based preservative that is used in multi-dose medication vials to prevent germs, bacteria, or fungi from growing in it and contaminating the vaccine or medication. Okay, on July 1st, 2006, California instituted a mercury-free act, and this prohibits administering mercury-containing vaccines to pregnant women or to children younger than 3 years of age. However, Sharp goes above and beyond this, and we are offering the thimerosal-free, preservative-free vaccine to every single person whom we vaccinate at Sharp Reese-Stealy. All right, let's talk about the supplies that you are going to need to set up your flu station. Of course, you're going to need your vaccine, and that is going to need to be properly stored, and the temperature is going to need to be properly monitored, and we'll talk about that in just a moment. You're going to need the appropriate size needles to give IM injections to populations of 6 months of age and older, all the way up through adults. You're going to need either a refrigerator or a cooler, alcohol swabs, gloves, hand sanitizer, Band-Aids, Sharp's container, and you're going to need pens. And make sure you keep your pens clean, wipe them down as needed so that they're not a source of cross-contamination in your flu clinic. All right, let's talk about maintaining the cold chain. For these vaccines to be effective and not be compromised, we have to maintain the cold chain. The cold chain starts with the manufacturer during the manufacturing process of the vaccine, and then it goes into the distribution where it still needs to remain cold. Once it arrives at our facility, this is where we become responsible for maintaining the cold chain. It has to stay cold all the way up until from when it arrives at our facility, from storage all the way until we administer it. It's extremely important, or we can compromise our flu vaccine. It may not be as effective, and there can be microbial growth from it not being stored at the proper temperature. All right, so I'm going to talk to you about how to transport and store the vaccines while you're in the flu clinic. And after I do this, Lynn is going to play us a video that of her packing a cooler for the flu vaccine. Okay. So the first thing you have to do is you get your cooler, okay? And then on the bottom, you're going to place conditioned items. And we consider conditioned items to be cold packs or frozen water bottles. So you place the conditioned items to cover only half of the bottom of the cooler. You're not packing the whole cooler full, just half of the bottom, okay? Once you have the conditioned items on the bottom, then you're gonna cover it with a 2-inch layer of bubble wrap, okay? And you're going to have a buffered probe on top of the bubble wrap, directly above a cold pack. So what we're doing now is we're putting our temperature probe in there, so we're going to know how cold the vaccine is, and we're protecting the vaccines from the ice packs or frozen water bottles, all right, with the bubble wrap. After you have the bubble wrap and the probe, then you're going to layer the vaccine boxes on top of the bubble wrap and probe. Don't let the vaccine boxes touch the frozen cold packs or the frozen water bottles, okay? After you've layered your vaccine boxes, then you're going to do another 2-inch layer of bubble wrap before you place the next layer of cold packs and frozen water bottles. Okay, so once you got that 2-inch on top, then you add your cold packs and frozen water bottles. Okay, and remember, you're not letting any of the vaccine boxes touch the water bottles or the cold packs. Okay, and then once you've done that, you layer bubble wrap to close the top of the cooler. You close the cooler, and you're going to record temperatures before departure on the transport log. And then you're going to carefully attach the digital display and log on top of the cooler. Right, so let's see what that looks like. And I am going to ask Lynn to go ahead and share this video with everybody.
Okay, thanks, Meg. Here we go. Hi, I'm Lynn from the Training and Education Department. I'm going to show you how to pack vaccines for transport to flu clinics. Okay, so first you need a styrofoam container or a cooler. You need some cold packs, you need some bubble wrap, and of course you need the vaccines and a thermometer or digital thermometer that you're going to use for monitoring the temperature. So first you want to take your frozen cold packs, keep them in the freezer till they're ready to use, and then you want to take them out 1 to 2 hours before packing so they soften up just a little bit and start sweating. They're called conditioned that way. You're going to fill the half the bottom of the container with cold packs, okay? And then above the cold packs, you're going to put 2 inches of bubble wrap, okay? So we're going to fill about 2 inches there. Then we're going to put our vaccines in the container, okay? We don't want to put the vaccines on top of the cold pack, but before we put the vaccines in, we want to put the thermometer probe, okay? Then the vaccines on top of that. Then another 2 inches of bubble wrap, okay? And then we're going to fill half of the container again with conditioned ice packs. And then we're going to put more bubble wrap in to fill it to the top of the container. We're going to close it. We're going to put our digital thermometer readout on top, and we're going to document the temperature. And in the flu clinic, we're going to document the temperature every hour. And that's how you fill a cooler with vaccines for your flu clinic. Okay, Meg, you can take it back.
All right. Thank you, Lynn. Give me just a moment and I will get everything set up. All right, we had a question in the chat. Will we have a cheat sheet of the proper packing? Lynn, is that on the,
yeah,
it's on SharePoint?
Yeah, if you go back, Meg, 1 slide. See, and go click back, yeah, see that document on the right, packing flu vaccine checklist, that is on SharePoint, and we're going to show you where that is. And you'll actually have both of these documents on SharePoint that you can refer to them. Good question.
Yeah, we have a lot of resources that anyone can easily access via our SharePoint website. So towards the end of today's class, I will show you how to find all of that. Okay. We also have a frequently asked questions in there. And whenever we get questions, we add it to that so that everybody has access to these frequently asked questions. All right, this is what the refrigerator temperature log will look like that you will need to be documenting in your flu clinics. All right, so it has to be documented every hour. The temperature of the flu vaccine needs to stay between 36 to 46 degrees Fahrenheit. And it has to be checked hourly and recorded on this refrigerator temperature log. All right, as I mentioned earlier, that since all of our flu vaccine that's being shipped to Sharp Steely is single dose and with no preservatives, and they come in manufacturer filled syringes. All right, a manufacturer filled syringe should be activated right before you use it. We should not be prepping these in advance to try and save a little bit of time. You want to activate them immediately before use. Keep in mind that a manufacturer filled syringe, as I said earlier, does not have a preservative. And the moment that we activate it, the flu vaccine becomes susceptible to microbial contamination and growth. So that is why we don't want to activate it until right before we use it. We want to keep it in the refrigerator and then take it out, or in the cooler, take it out, activate it, and then use it. Okay. It says here, once the sterile seal has been broken, the vaccine should be used or discarded by the end of the workday. However, at Sharp Re-Steely, our workflow is that it needs to be used immediately, and if it's not used immediately, it needs to be discarded. All right, this is what our 2020-2021 influenza forms look like. It's important that you give it to the right population. So, for example, adults 18 years and older need to receive this one over here on the left, okay? Adult 18 years or older. And the right one is 6 months to 17 years old. If you are working in pediatrics and you are offering vaccines to parents, make sure you give the parent the adult one and not the pediatric one. We've had it happen where the adult accompanying the pediatric patient has been given the pediatric administration form. So that is incorrect. It needs to go, it needs to be the correct age. So it's very important that this gets filled out in its entirety. We are finding in our medical records department that they are having a lot of incomplete forms being sent to them. And this is one, incomplete documentation, and two, it's causing a lot of extra work. So we want to make sure that this gets filled out in its entirety the first time. Okay, so the sticker, you can fill it out, that top part with the patient's name, or you can place the patient's label there. You need to have the patient answer all of the following questions, or on the pediatric form, it can be the patient or the parent or guardian who fills this out, okay? Down below, it's there below on the adult one, it says for employees, I give consent to have this documented in my Sharp Re-Steely medical record. So if you're a Sharp Re-Steely patient, you can put yes or no. And if you put yes, it will go into your record. All right, and then down below, you have to fill out everything in that gray box as well. All right, you're going to be referring to the standing order and the influenza formulation grid to decide which formula you're going to be giving to the patient. All right, make sure you put where the site was, fill out lot manufacturer, expiration date. You need to verify that you check 2 patient identifiers. And if indicated, you would take a patient's temperature. And then if there's no signs of an adverse reaction, you're going to check that. You need to make sure that you sign and put your title and date it, okay? If it is a medical assistant that is filling this form out, then the ordering physician's signature needs to be on this form, all right? And if the physician is the one verifying the medication with the medical assistant, that needs to be checked. You also need to check that you gave them the vaccine information sheet. You need to check a CPT code. And if you look at the very bottom, it says for administration use only. Immunization history entered in EHR. You need to check that if you've done that. And charges entered in EHR. If you have done that, you need to check it. If you don't check these and they go to medical records, they're going to have to go back in and pull up the chart to see if it was done. All right. And often what's happening is they're pulling this up and they're going in and they're seeing that it was entered, but it was not checked. And that's causing a lot of extra work for our medical records department. So we want to make sure that we check those boxes. Okay. Do you have anything to add to that, Lynn? Oh, you're on mute.
No, thank you.
Okay. All right. Right, so these are, I talked about some of the common documentation errors we're seeing, but I'll point out a few more. We're finding some old forms from last year and previous years have somehow made their way back into circulation. It has to say 2020, 2021, all right? And it cannot be edited. No one can go in and make changes to this document. Any changes to the form have to go through the SRS flu committee. We've had a lot of issues with signatures missing as to who administered the vaccine. It's going to be very hard to recover to find out who administered it because it's being administered in a clinic, flu clinic. If the medication, we talked about this already, I showed you on that form, if the medication was given with an order or standing order, the immunization history box must be checked, and you also must check if charges were entered. And that is this, if I go back one, I'll go to this one on the left, the adult one at the very bottom. They're talking about these boxes right here, okay? Because we want to prevent HIM from having to go in and double check. Okay. Forms have had a lot of messy copies. Remember, this is part of their medical record. We want a nice, clean form that is legible, that can be scanned and look professional in their medical record. You should not have messy copies. You can print off new ones, and we will show you where to get them in the SharePoint, our SharePoint site. Okay. We've had top headers and the bottom missing from some of the forms, which means you're going to miss those bottom ones that I just showed you, checking to make sure that immunization history was checked and charges were entered. Okay. And some forms don't have the vaccine CPT code checked off for what was given. We can't charge for this if we don't know what was given. So that has to be checked, and that is down here. I'll show you on the bottom left one, this box right here. You have to check which vaccine you gave. All right, and as I mentioned earlier, parents of pediatric patients are being asked to complete the pediatric form instead of the adult form. We also have missing lot and expiration dates on some forms. We have to have that, all right? When I go back here, we have to know what the lot number was and what the manufacturer and expiration date were. That's mandatory for any vaccine administration that we do at Sharp Reese-Steely. And when we're using our electronic health record, those are yellow fields, so we know that they have to be put in there. When we're doing the paper charting, it can be easy to miss that, but we cannot miss it. I got a question, what is EHR and where do we enter EHR? EHR is our electronic health record, and this training will happen on site if you haven't been trained yet to use the electronic health record or during your orientation.
So Meg, did you answer the other question about the flu sticker? Did you see that one? Can you place the flu sticker on the sheet instead of filling out the lot number? So do you mean the little sticker that comes on the syringe? Yes, because then that saves you some time. But you do need, that's it. Actually, you know what? That's a good question. Ask the supervisor on site. I would stick the sticker on there just because it saves you time. Does it replace you having to write it out? I would think it would, but check with the supervisor on site. That would be a good time saver. And SCWISI170, can you please change your name so you get credit for the class, or at least put it in the chat what your name is so I can give you credit for the class? And then I do have somebody named Vero, V-E-R-O. If you can please chat me what your full name is so you get credit for the class. Thanks.
Okay, thank you, Lynn.
Okay.
All right. We have someone saying that that's what they did last year, was put the sticker on.
Yeah.
But okay, yeah, like Lynn said, follow up your supervisor to make sure that that is an acceptable practice.
Yeah, I'm sure it is. Yeah.
And then pediatrics between the ages of 6 months and 9 years who meet this criteria, they need 2 doses of the 2020-2021 influenza vaccine during the season. And to meet this criteria, The child's flu vaccination status is unknown. We don't know if they've ever received a flu vaccine. Okay. The child did not receive the flu vaccine this year, and the child never received a second dose at all before they were 9 years old. Okay. The second dose is due 30 days or more after the first dose. 28 days. This says 30, but it's been corrected to 28 days. If they come in at 27 days, it's too soon. Day one starts the day after it was administered. That is day one. It's been 1 day. Okay. And you'll be giving, for those children who need to come back for a booster dose, you'll give them this form, put the patient label on there, and then give them the date that is due 28 days or more later when they can return. They cannot return earlier than that.
So Meg, there's a question in the chat. I was told that if all the info is on the paper, that I did not need to put it in the EHR because it would be scanned into the record. Somebody's going to, so the flu clinic folks, yeah, you just have to write it on the sheet and somebody is going to enter it in as history. So that's correct, because you won't be, if you're just working exclusively in the flu clinics, you won't be going in the EHR, except maybe to look up somebody's vaccine history.
Yep, that's the only reason why you'll be in there.
Yeah, but there'll be somebody else entering it in for you, so you can keep moving.
And this will help your flow in the clinic. You won't have to, go into the chart, and then you'll just have to check their immunization history in the chart, and then you can proceed. And then the rest of the documentation will be entered for you. That's why we need those forms filled out in their entirety, because a second person will be managing this. We are going to be offering FluMist this year in pediatrics, family medicine, and drive-up flu stations. All right, there are certain questions that have to be asked with this to determine if they are a candidate for the flu vaccine. Okay, they have to answer. Okay, they cannot receive the FluMist if they answer yes to any of the questions in number 2. Have they been ill in the last 24 hours? Temperature greater than 100.6? Allergy to gentamicin, gelatin, or arginine? Life-threatening reactions to any influenza vaccine in the past? If they are between the ages of 2 to 17 years old, if they are currently receiving aspirin or any aspirin-containing therapy, they cannot receive this. And if they are under 2 years of age, they cannot receive it. Okay. All right, these are our standing orders. And in just a moment, Lynn is going to play a video on how to use the vaccine, the FluMist vaccine, how to administer it. All right, these are our standing orders for LVNs. We have different ones for LVNs and RNs. All right, so for LVNs, you are going to follow this standing order, and we will show you where to find it. And you always want to look for this on our SharePoint Drive, because this does get updated periodically, and we want to make sure that, that you're using the most up-to-date one. Okay? So you will follow this specific standing order before you administer the vaccine. The patient has to meet all the criteria on here for you to administer. Registered nurses are going to be working off a different set of standing orders. We have one that's specific to pediatrics, one that is specific to FluMist, and one that is specific to adult. So registered nurses, you need to be sure that you are very, very familiar with all of these and that you have these on hand in your flu clinic so that you can refer to them. All right. All right, any questions about this? You guys are going to be reading through this on your own. And it tells you when you can administer it and when you cannot. After the patient receives their flu vaccine, we are asking that you request the patient takes a photo of the flu administration form with their cell phone and advise the patient that it could take up to 4 weeks to get a copy if they request documentation of administration through medical records. All right. So the best thing for them to do if they need proof of vaccination immediately is, or if they're going to need it in the next month, is to take a picture of this with their cell phone. All right, next we are going to show you the FluMist video on how to administer this.
Okay.
And Lynn is going to play that for you.
Okay. All right, here we go.
Dosing and administration information for FluMist Quadrivalent. FluMist Quadrivalent is the only intranasal needle-free flu vaccine for patients ages 2 through 49. It starts working at the typical site of viral entry and infection, the nose. Children ages 2 through 8 who have previously received a flu vaccine, and children, adolescents, and adults ages 9 through 49 should receive 1 dose of FluMist Quadrivalent. Children ages 2 through 8 should receive 1 or 2 doses of FluMist Quadrivalent, depending on their vaccination history. If 2 doses are required, they should be given at least 1 month apart. This is the FluMist Quadrivalent sprayer. Each sprayer contains 0.2 milliliters of the vaccine. Half of the contents in each single-dose sprayer should be administered into each nostril. Start by checking the expiration date on the sprayer label. Next, remove the rubber tip protector. Do not remove the dose divider clip at the other end of the sprayer. Patients should stay in an upright position and can breathe normally throughout administration. To help prevent the patient from moving their head, place one hand behind the patient's head while administering the vaccine with the dominant hand. Begin administration by placing the tip of the sprayer just inside the nostril to ensure the vaccine is delivered into the nose. With a single motion, depress the plunger as rapidly as possible until the dose divider clip prevents you from going further. Pinch and remove the dose divider clip from the plunger. Place the tip just inside the other nostril and with a single motion, depress the plunger as rapidly as possible to deliver the remaining vaccine. Following administration, dispose of the sprayer in a Sharps container or biohazard container. There is no need to sniff throughout administration, and there is no need to re-administer if the patient sneezes or swallows or if dripping occurs. As the only intranasal needle-free flu vaccine, FluMist Quadrivalent provides an option for vaccination for patients who prefer an alternative to injections. Important safety information for FluMist Quadrivalent. FluMist Quadrivalent is contraindicated in persons who have had a severe allergic reaction, for example, anaphylaxis, to any vaccine component, including egg protein, or after a previous dose of any influenza vaccine, and in children and adolescents receiving concomitant aspirin or aspirin-containing therapy. In clinical trials, the risk of hospitalization and wheezing were increased in children less than 24 months of age who received trivalent FluMist. Children less than 5 years of age with recurrent wheezing and persons of any age with asthma may be at increased risk of wheezing following FluMist Quadrivalent administration. FluMist Quadrivalent has not been studied in persons with severe asthma or active wheezing. If Guillain-Barré syndrome has occurred within 6 weeks of any prior influenza vaccination, the decision to give FluMist Quadrivalent should be based on careful consideration of the potential benefits and risks. FluMist Quadrivalent has not been studied in immunocompromised persons. The safety of FluMist Quadrivalent in individuals with underlying medical conditions predisposing them to wild-type influenza infection complications has not been established. Appropriate medical treatment and supervision must be available to manage possible anaphylactic reactions following administration of the vaccine. FluMist Quadrivalent may not protect all individuals receiving the vaccine. The most common solicited adverse reactions, occurring greater than or equal to 10% in vaccine recipients and at least 5% greater than in placebo, reported were runny nose or nasal congestion in persons 2 through 49 years. Fever greater than 100 degrees Fahrenheit in children 2 through 6 years, and sore throat in adults 18 through 49 years. Among children 2 through 17 years who received FluMist Quadrivalent, 32% reported runny nose or nasal congestion, and 7% reported fever greater than 100 degrees Fahrenheit. Among adults 18 through 49 years who received FluMist Quadrivalent, 44% reported runny nose or nasal congestion, and 19% reported sore throat.
Is that the end?
That's the end.
Okay. Very good.
All right, can you guys see my screen? Hold on, let me ask that again when I can see people. Lynn, can you see my screen?
I can see your screen.
Okay, excellent.
Yes, we have some chats that say yes. And thank you, Kelly.
If you give the FluMist too quickly, it will fall out of the child's nose. That happened to one of my children. Not quick enough, I'm sorry. If you give it too slowly, it will just fall out. And I did have that happen to one of my kids once. All right, so let's now talk about our senior dose, 65 years and older. We're happy to announce that this year we do have the Fluzone High Dose. This formula contains 4 times the amount of antigen, which is the inactivated virus, promoting the protective immune response against the flu virus. All right, so for our seniors ages 65 and older, they can get this, and they are the population, they're one of our populations that is very high risk for serious complications from the flu. So first of all, we want to make sure they get vaccinated, and we want to be able to give them this high dose one as well. Okay. And there's some interesting information from a clinical trial that looked at 30,000 participants, ages 65 and older, and those that got the high dose vaccine had 24% fewer influenza illnesses compared to those 65 years and older who got the standard dose of the flu vaccine. Okay. This is our flu vaccine administration grid for this flu season. And as you can see, we have 6 different formulas, okay, that we can offer to our patients. They are all pre-filled syringes, or for the FluMist, it's a sprayer, okay? And it tells you how it's supplied, the CPT code, the manufacturer, and very important, the age. When they are eligible to receive this, all right? So as you can see, for the first 3, you have to be 6 months or older. For the Flucelvax, you have to be at least 4. If you administer a 3-year-old the Flucelvax, it's considered a medication error. It is not FDA approved to be given to anybody under the age of 4 years old. Then we have the high dose one, which is the, trying to read this, Fluad Quadrivalent, and this one is for ages 65 years and older only. So if you give it to someone less than 65 years of age, it's considered a medication error. And then the final one is the FluMist, 2 years to 49 years of age. And then it also, okay for use in children under the age of 3 years old. You can see that we have 4 of our vaccines that these children are eligible to receive. The dose is here as well, all right, and it lets you know what allergens it contains, which is neomycin, gentamicin. Is it light sensitive? Is it preservative free? All of them are. All of them are latex free. And then you also see here on the next one, is it okay for use in pregnant women? You have to use one that is FDA approved for use in pregnant women if your patient is pregnant. And then the next one is it okay for nursing mothers? So all this information is available for you, and it is on SharePoint, and you will have it in your flu clinics. Keep in mind that you have to give the patient the vaccine information sheet prior to administering the vaccine. They have to have the opportunity to read this and about why they need to get vaccinated and the risks of it and what to do if there's a serious problem. This allows them the opportunity to refuse the vaccine if they choose. Unaccompanied minors, if say a 16-year-old child comes in and wants to get the flu vaccine, they need to bring in this authorization for consent to medical treatment of a minor. And this has to be filled out and signed by their parent or guardian or whomever has legal custody of them. If they present to the clinic and they do not have this filled out, we cannot administer the vaccine to them. Even if they are 17 years old and look like an adult, it doesn't matter. They have to have this filled out. All right, let's talk now about the 7 rights of medication administration. Because when we follow our 7 rights and we do our 3 checks with medication administration, we significantly decrease the risk of having a medication vaccine error. You always want to make sure you have the right patient. This can be tricky. When you have a parent shows up with a carload full of children, you need to take your time and make sure it is safety over speed in this situation, because you want to make sure that the right patients get the right vaccines. Because remember, we have different ages and people are going to have be eligible for different vaccines depending on their age. And you're going to be looking up their immunization history. You want to make sure you're looking up the proper person. You want to make sure you have the right medication. So is this vaccine that I'm giving them, and when I go to my flu grid, do they meet criteria to receive this vaccine? The right dose. The nice thing about our flu vaccines is that they are all pre-filled. It is 0.5 mLs for all of our injections. Right route, right site. Okay, we want to make sure we give it in the right muscle and that we do give this intramuscularly, or if it's nasally, we give it nasally. Right time. This is important. When did they get their last flu vaccine? Did they already have one this flu season? Keep in mind that we have patients with different levels of health literacy, so they understand their health care differently. Everybody, depending on their background, their education, there may be certain barriers that prevent them from understanding their care. We want to make sure that we are not accidentally double vaccinating someone. This has happened in the past at Sharpre-Steely, where a patient went in to their primary care provider, they received a vaccine, the same day they went to a flu clinic and received a second flu vaccine. So you really want to make sure that you check their immunization history so that you are not giving them a second dose. And then also with our pediatric patients, when they come in, you want for that second booster shot, you want to make sure it has been at least 28 days. Right documentation. This goes back to that form. If you don't properly fill out that form that I showed you earlier, or the one that we're already having reports of being filled out incorrectly or not completely, you are missing right documentation. So you are not meeting the 7 rights of medication administration if that is not filled out properly and completely. And then 7, of course, is the right reason. Then we have our 3 checks that we do. We are always checking the name of the medication, the dose, and the expiration date. So often we have medication errors are because of the wrong expiration, the expiration date, it was expired. And that is just tells us that the individual who administered the medication didn't do their 3 checks. So you do the 3 checks every single patient, every single time. Okay, so medication name, dose, and expiration date. And you're double checking when you're doing this and triple checking that you were giving them the right formula based on the flu information grid.
So Meg, there
Yes.
is a question in the chat. Minor is 16 and below. So
Mhm.
minor would be 18 and below.
Under 18.
Under 18, sorry, not 18 and
Yeah,
below.
so
Under 18.
17 and younger. You're no longer a minor when you turn 18.
Thank you.
Thank you, Lynn. Okay. All right, so these are the 3 checks, 3 different times. It's like Superman, up, up, and away, except we say out, up, and away. All right, so when you're pulling the flu vaccine, you're going to check it. As you're preparing it, that manufacturer filled syringe, all right? And then before you administer it, okay? As you're walking to administer it. Those are your 3 checks, out, up, and away. And you're also looking to make sure that the medication was not tampered with. And that, I can have you guys mute yourself, please. Ensure that the medication was not tampered with and that the liquid looks to be a normal color, consistency, etc. All right, next what we're going to do is Lynn is going to play us a video from the CDC on intramuscular sites and identifying them.
Here we go.
In this video, I will identify intramuscular injection sites. This route is abbreviated IM. Before administering any vaccine, always start with proper hand hygiene. CDC has hand hygiene guidelines and resources for healthcare personnel available online. An intramuscular injection deposits vaccine deep into the muscle tissue to allow for rapid absorption. The deltoid and vastus lateralis muscles are the recommended sites for administering vaccines by IM injection. For children birth through 2 years of age, the recommended injection site is the vastus lateralis muscle because of the relatively large muscle mass and the lack of major nerves and blood vessels. This muscle is located on the anterior or outer aspect of the thigh. Sometimes children need more than one vaccine during the same medical visit. The vastus lateralis muscle is preferred for administering multiple IM injections to this age group. To correctly identify the muscle, expose the child's leg. The entire thigh should be clearly visible. To find the injection site, place one hand across the top of the thigh and the other hand just above the knee. Give the IM injection in the area in between. Here's another way to find the vastus lateralis muscle. When a toddler or young child stands and their arm is relaxed and hanging down to their side, their middle finger dangles just over the vastus lateralis muscle. For persons 3 years of age and older, the deltoid muscle is the recommended site for IM injections. This muscle is located in the upper arm and is shaped like an upside-down triangle. If more than one vaccine is needed, the deltoid muscle can be used. To identify the site, have the patient seated with the upper arm completely exposed. Ask the patient to relax their arm. Shirts with tight-fitting sleeves that cannot be rolled up above the shoulder should be removed. Locate the acromion process or bony point in the shoulder. This marks the base of the upside-down triangle. The tip of the triangle is directly below the middle of the base at about the level of the armpit. The correct area to give an IM injection is in the center of the triangle, 1 to 2 inches, or about 3 fingers widths below the acromion process. Before administering any IM injection, check for lumps, swelling, redness, warmth, bruising, or wounds near the injection site. Sometimes a patient may have a tattoo located on the injection site. Intramuscular injections may be given through a tattoo. When more than one vaccine is administered, separate injection sites by at least 1 inch if possible. Local reactions such as redness, swelling, or a sore injection site are associated with some vaccines more than others. Administer these vaccines in separate limbs if possible. CDC has injection safety resources for healthcare personnel available online at www.cdc.gov/injection safety. This video is part of a series designed to demonstrate vaccine administration skills and best practices. The series is available on the Vaccine Administration website at www.cdc.gov.
Okay. Give me just a moment to get my screen back and we will start. All right, so that's a really good video demonstrating IM injections. A couple more notes. Looks like I disappeared here.
I can see your screen.
You can see it? Okay.
Yeah.
You want to use the 90-degree angle always for intramuscular injections. You don't ever want to tent the skin unless they are super emaciated. You want to pull it taut, otherwise you can end up in the subcutaneous tissue. Aspiration is not required for vaccines. It is required for medications, but not vaccines. Always identify appropriate landmarks before needle insertion, and this is extremely important because we want to avoid injury to any nerves, joints, or other surrounding tissues. Keep in mind our bodies were not designed to have a needle jabbing through them with a substance in them. So when we do this, we have to do it very, very safely. And we can have long-lasting complications from a flu vaccine that is improperly administered. All right, the vaccine sites that we can use are deltoid for ages 3 and above, or vastus lateralis for children who are 6 months through 2 years old. Okay. So the video had a really good demonstration of the deltoid muscle. Okay, this is for ages 3 and above. We don't want to use it for less than 3 because it's just not developed enough. All right, there is always the potential, as with any IM injection we give, for injury because, and in the deltoid, we have axillary, radial, brachial, and ulnar nerves that run through this area. Okay, and the brachial artery lies within the upper arm. So it's really important, I'm going to see if I can do this, that when we give the medication, if you see up here, do you see the, where to the right, this picture on the right where I'm circling? That is the acromion process. That is that bony area, all right? You want to go 2 to 3 finger breaths below that to find really the meat of the muscle. So you can see here the deltoid is a triangle, right? It's pretty much a triangle. We want to get in the meaty part right here, right in the meat of the muscle. If we go too high, if we go too high, we can first of all hit the bone and we're not going to go anywhere and we're going to hit that acromion process. If we go right below the acromion process, we could go into the joint, and we have had flu vaccines go into patients' joints. And when that happens, it can be excruciatingly painful, and it can also has caused infections in the past. So now we have a patient who comes in for a flu vaccine and they walk out with a joint infection. So we want to be extremely mindful when we are giving the flu vaccine that we administer it properly. And if you come down to the bottom here, if you see where I'm drawing on the triangle, this is where the muscle attaches to the bone. If we give the flu vaccine down here, the patient is going to have a whole host of other problems because we're going to be getting into a very small part of the muscle. We're going to be hitting tendons and ligaments, and it is going to be extremely painful for the patient if you go too low. I've told this story several times, so some of you may have heard this, but this happened to my mother last year during flu season. She went in to get her flu shot, and they gave it to her at the very bottom of the muscle. And she ended up with extremely debilitating pain that required months of physical therapy and massage. And now that she hasn't been going to PT and massage for the last several months, the pain is back. And she has a host of underlying medical conditions and severe chronic pain conditions. Adding this on top of it was a devastating injury to her. So keep in mind that we have to be so mindful when we administer vaccines, because we not want our patients walking away in a worse condition than they came in. Okay. Hold on one moment. It looks like when I do that, I can't advance. Okay. Vastus lateralis, this was described very well in the video. This is for ages 6 months through 2 years, and this muscle is very well developed in pediatric patients in this age group, so this is a very safe place to give it to them, and they demonstrated how to find it in the video. It's basically the same spot that we give somebody who is having anaphylaxis, and we instruct them to take their arm and go straight down to their thigh. Okay, they're going into their vastus lateralis. That is a large muscle in the thigh, and you go in the middle third. And the middle third is between the greater trochanter and the knee on the lateral side. Okay. Now it's very important that we safely restrain our pediatric patients, because number one, we don't want our kids getting injured, and we do not want you getting stuck with a needle because a pediatric patient moved. I recently had to take my 8-year-old daughter to get her labs drawn, and she was adamant that they not touch her because the time before they weren't able to get labs on her. She was too dehydrated. So when I brought her back, she was, let's just say, extremely vocal about not wanting these labs done. So I held her. They instructed me, and I was familiar with this from our classes. So if you go to this middle one under restraint video to photo B where I'm circling, this is how they had me restrain her, except she had one arm out. But I had her legs in between my legs, and I held one arm over, and then two of them one restrained her other arm, and one got her labs. And we were able to successfully do this, and we kept me safe, we kept my daughter safe, and we kept the lab technician safe. So depending on the age of the child, there's different positions that you see here. And we have these nice flyers that describe them for you that are available on SharePoint. And we're also going to show you a video of these being done. So I'm going to turn it over to Lynn to play the video.
Okay.
In this video, I will demonstrate comfort and restraint techniques for infants younger than 12 months of age. Immunizations are vital for the health and well-being of children, but getting a vaccine can be stressful for both infants and parents. Including parents or other caregivers when administering vaccines increases the comfort level of an infant during vaccination. It is important for the safety of the infant and person administering the vaccine that the infant does not move during an injection. The person administering the vaccine needs complete access to the limb. Instruct the parent or adult who brought the infant to sit and hold the infant in either a chair without arms or on an exam table. The vaccine administration site needs to be clearly visible. Have the parent hold the infant on their lap. The infant should be turned to the side. Tuck the infant's arm between the infant's and the parent's body. Then put the parent's arm around the infant, holding the infant's outer arm. Put the parent's other hand on the infant's leg near the parent's thigh. If the parent or adult is uncomfortable holding the infant, have another person hold the infant. In this section of the video, I will demonstrate comfort and restraint techniques for children 12 months through 35 months of age. Have the parent hold the child on their lap with the child facing to the side. Move one of the child's arms under the parent's arm and behind the parent's back. Then put the parent's arm around the child and tell them to hold on to the child's other arm. The adult will now be holding both of the child's arms in place. Put both the child's legs between the parent's thighs. Put the parent's other hand on the child's leg near the parent's thigh. If the parent or adult is uncomfortable holding the child, have another person hold the child. In this section of the video, I will demonstrate comfort and restraint techniques for children 3 years of age and older. Have the adult hold the child on their lap with the child facing to the side. Move one of the child's arms under the parent's arm and behind the parent's back. Then place the adult's arm around the child onto the child's outer arm, holding both the child's arms in place. Put the child's legs between the parent's thighs. Place the parent's other hand on the child's legs near the parent's thigh. If the parent or adult is uncomfortable holding the child, have another person hold the child. This video is part of a series demonstrating vaccine administration skills and best practices. The series is available on the Vaccine Administration webpage on the CDC Vaccines and Immunization website at www.cdc.gov/vaccines.
All right, so keep in mind that if the parent is not able to properly restrain the child, and they touched on this at the end here, please find another staff person to help you. Okay, because sometimes when a child gets upset, the parent can get very upset too. And if you don't think they're going to be able to properly hold their child in that restraint, then you absolutely want to ask for help, because we do not want the child, the parent, or you getting injured during this process. All right, what we're going to do now is, we've been on for a little over an hour. We're going to go ahead and take a break. And I'm going to have everybody come back at, we're going to get started in 10 minutes. So at 2:25, we will resume the class. Thank you. Everybody just stay on and just put yourselves on mute. All right, this next slide shows our Magellan safety needles that we have here at Sharp Reese-Sealy. There are 3 methods of activation of the safety device, depending on the on your specific situation. We prefer that you use the flat surface, because when you use the flat surface and you put it on a flat surface, you keep it parallel and pull it back down, your fingers are not in the way. There's no chance you're going to get stuck. The manufacturer does say that you can use the finger or thumb, and it is acceptable to use that, but it's not what we prefer. You're putting your finger right by the needle when you do that. So whenever there's a flat surface available to use, please use the flat surface to activate the safety as you see here. For those of you that are new hires, and if you attended a virtual clinical staff orientation and you didn't get the hands-on practice with these Magellan safety needles, please, with whoever is precepting you or orienting you, have them demonstrate activating the safety on using a clean needle, and you do the same prior to doing this on a patient. You want to have that practice first. You don't want to be learning on a patient. Oops. All right, so this shows you how to activate the safety needle. You press the safety shield, the lever side down. Okay, that's this part right here, lever side down onto a flat surface, and this covers the needle and locks the shield. And you'll hear a faint little click, okay? Really important that you hear that, and that is your indication to you that the safety has been activated, and it should be immediately disposed in a Sharps container afterwards. Okay. In this next slide here, under the standing orders for the flu clinic for registered nurses, we have information in here for an epinephrine, the dose that you need to give for epinephrine if the patient has anaphylactic reaction. And you can see for patients who receive 0.15 up to 0.3 milligrams that they can use the auto dose. And we'll show you a video of that in just a minute. Lynn, do you want to talk to them about that really minute dose for our little pediatric patients that is either less than 0.15 or if they're in between doses?
Sure. So you can see that there's 2 EpiPens. One is for peds that Meg mentioned, it's 0.15 milligrams. And that would be for kids up to between 32 and 64 pounds. And then the adult version of the EpiPen is a 0.3 milligrams, and that would be for kids 65 pounds and over. So what do we do for the little infants that are under 32 pounds? So we don't have an EpiPen for that small of a dose, so we would have to use a 1 ml vial of 1 to 1,000 epinephrine for IM injection, and you would have to draw that up. And if you look at this grid on the left, it says to give children under 32 pounds 0.1 mLs. So you would have to have like a little TB syringe to drop that little amount and a 1 ml needle to fit on it. And you'd have to draw it up from the 1 ml vial. So that is the outlier. I just want you guys to feel comfortable with this grid that was created. A lot of eyes have been on this. This has been approved by the SRS Pharmacy, and at the time, the chair of the pediatric department, Dr. Golembeski, Dr. Phil, who's the medical director of the urgent care, and actually this follows the guidelines by the San Diego paramedics as well. So I want you to feel comfortable with these dosages on this grid, and you'll notice the volume is in the far right-hand column, and the dose, the number of milligrams, is in the second column to the left. So what the standing orders say is to administer the EpiPens based on the correct weight. Again, if they're under 32 pounds, you would have to draw up your own. So you want to make sure that you have your EpiPens and the 1 ml, 1 to 1,000 dose of epinephrine available, along with the 1 ml syringe with the 1-inch needle for administration, and have this chart all together in an anaphylaxis kit. And hopefully you will never need it, but it's there if you do.
Thank you, Lynn. Was there a question? Yeah, go ahead, Robin.
Yeah. Should we be housing an EpiPen within our department? Because, I mean, I know we no longer have a full crash cart at our site. We have an AED and limited things on the crash cart. I think epinephrine obviously probably being one of them, but should we have an EpiPen within our unit?
I would. Anytime you're administering this, there's always the risk. It's a small risk, but it is a risk. And you don't have that much time if somebody does have an anaphylactic reaction. So you do want to have the emergency meds available. So I would check with your supervisor about having some sort of an anaphylaxis kit available.
Okay, thank you.
Okay.
And keep in mind too that epinephrine, it comes into 1 to 1,000 for IM administration. Your crash carts have the 1 to 10,000, and that this is a LASA drug, a look-alike, sound-alike, and you do not want to administer that 1 to 10,000. That is for that's advanced cardiac life support that is given intravenously to somebody who is technically dead that we're trying to bring back. So make sure that this is the vial, the 1 to 1,000, not the 1 to 10,000 auto injector.
Thank you, Meg.
Okay. All right, and Lynn is going to play the EpiPen video for those of you. Has anybody here given epinephrine with an EpiPen?
So Meg, I
Yes.
clicked away from that video and then closed it by accident. Can you just click on the link on the PowerPoint? It'll probably be the quickest
Yeah,
way.
should be able to do it.
Yeah.
Okay. Make sure.
There we go.
Can you see it?
Yep.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly
it's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
An EpiPen and EpiPen Junior are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Junior should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Junior, the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube.
Just flip open the yellow cap,
Or the green cap.
slide it out, and hold it like this.
Blue to the sky,
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there, but don't worry, your EpiPen Junior auto-injector gave you the right dose, and it has a special feature, the Never See needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away. Call the ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 EpiPen auto-injectors wherever you go. They even come clipped together.
Because some people might need the second dose.
Take your expired or used EpiPen auto-injectors to your doctor's office and ask for a refill.
Remember, epinephrine is the only first-line treatment for anaphylaxis, not antihistamines.
So just trust yourself and do it. Don't hesitate, especially if you know the symptoms of a life-threatening allergic reaction and have practiced with the gray trainer that comes in the box.
Because this is what's important to people like me.
And me.
Use EpiPen epinephrine injection USP 0.3 milligrams or EpiPen Junior epinephrine injection USP 0.15 milligrams auto-injectors right away when you have an allergic emergency, anaphylaxis. Get emergency medical help right away. You may need further medical attention. Only a healthcare professional should give additional doses of epinephrine if you need more than 2 injections for a single anaphylactic episode. EpiPen or EpiPen Junior should only be injected into the middle of your outer thigh, upper leg, through clothing if necessary. Do not inject into your veins, buttocks, fingers, toes, hands, or feet. Hold the leg of young children firmly in place before and during injection to prevent injuries. In case of accidental injection, please seek immediate medical treatment. Rarely, patients who have used EpiPen or EpiPen Junior may develop an infection at the injection site within a few days. Some of these infections can be serious. Call your healthcare professional right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, or the area feels warm to the touch. Tell your healthcare professional about all of your medical conditions, especially if you have asthma, a history of depression, thyroid problems, Parkinson's disease, diabetes, high blood pressure or heart problems, have any other medical conditions, are pregnant or plan to become pregnant, or are breastfeeding or plan to breastfeed. Be sure to also tell your healthcare professional all the medicines you take, especially medicines for asthma. If you have certain medical conditions or take certain medicines, your condition may get worse or you may have longer-lasting side effects when you use EpiPen or EpiPen Junior. Common side effects include fast, irregular, or pounding heartbeat, sweating, nausea or vomiting, breathing problems, paleness, dizziness, weakness, shakiness, headache, feelings of overexcitement, nervousness, or anxiety. These side effects usually go away quickly if you lie down and rest. Tell your healthcare professional.
Oops. Are you taking it back, Meg?
Yes, I've got it
Okay.
back.
Okay.
Okay. Can you guys see my screen?
Yes.
Okay. All right, now we're going to look at some pictures, and I want you guys to turn your mutes off when you see something and tell me what's wrong with this picture. Angle from Emily. Yeah, the angle is not right. It's definitely not 90 degrees.
No safety needle.
No safety needle. No PPE from Andreas, correct. No PPE, no gloves are being worn. Hand placement on the shoulder. Yeah, that person is going to get stuck. And how many fingers below that acromion process do you think she is? It's hard to tell. I doubt that is 2 to 3 finger breaths. It looks a little bit more, but it's hard to tell from here. Okay. And it looks like a little of that medication is oozing out too.
That's a lot of mLs to go into the deltoid.
Yeah, we have a lot of mLs, way more than I think on this age.
Child is not
1 ml.
restrained yet. Good.
Good.
All right.
All right, let's look at another one. What's wrong with this one? Angle, yeah, angle is completely wrong.
You guys can unmute yourselves.
Yeah, feel free to talk too. What about their finger placement of the person administering? Yeah, no safety needle.
Okay. Dose, yeah, that's a lot of
That's
fluid.
a lot. No safety needle, the angle, and then look where the healthcare providers' fingers are located. They're like about to get stuck.
Child's hands in the way, yep. Okay. Good.
There's an extra set of hands there that don't need to be there. An extra hand. All right, what about this one?
This one's painful to look at.
Too low. No gloves, yep. Too far. Yeah, we're down right there at the bottom of that triangle. So this patient, this is like the injection that my mom had. And look how he's grasping the patient's arm. It's like he's pinching the patient's arm hard. We end up with little fingerprint bruises. Yep, no PPE and proper hand placement, too low. Good job, you guys. And no needle safety on this one either. Oh, what about this one? This kills me. Touching the needle. Yeah, Kelly, exactly. LOL. What are they doing? No needle safety, touching the needle, pinching the skin is hard to, yeah, it's hard to tell what they're doing there. Everything, I like that one from Nadell. Looks painful. And okay, no gloves on, and now we are injecting this patient. We have a portal inside, you know, we're breaking that skin barrier. So I just see a recipe for an infection there. And any medication, it may be in the process of being dispersed. It's hard to tell. Okay. All right, so let's talk now about our drive-up flu stations. All of our flu clinics will be drive-up. So our goal this year, as I said, is to get as many of our Sharpie-Silly patients vaccinated. And we're going to be accomplishing this through our primary care providers, through specialty clinics, and that's why several of you are on today, because you work in a specialty clinic where we have not previously given vaccines or any type of injections, and now in this very, very crucial flu season that's upcoming, you are going to be responsible for adding, for administering flu vaccines to our patients. And we are also having our flu clinics, which will all be drive-up flu stations this year. They will be able to schedule, patients will be able to schedule on Follow My Health, and they'll have an opportunity to add family member names for appointments, and these appointments are going to be per carload every 20 minutes. And there's also, this is really important, there's going to be space to give injections outside the car if needed. Keep in mind, you don't want to be climbing into a really crowded car during this COVID pandemic, all right? They're going to be required to wear masks, and you, of course, will be wearing masks and goggles or face shield. However, we want to make sure that you stay safe. We don't want you putting yourself in any weird position to administer a vaccine. That's why we are going to have chairs and a space for the patients to get out of their car to administer the injections if needed. we're going to show you a video of what the flu clinic, a drive-up flu clinic may look like. Keep in mind, this is not Sharpre-Steely. We found this, and this is pre-COVID, so there's no masks being worn. So I'm going to have Lynn go ahead and play this for you.
Good job, What'd you get? You get a sticker? Well, you got a full house. Awesome. Wasn't too bad, was it? Good. You're still healthy.
Come right over here, sweetie. Stand right here for me. I'm gonna give you a shot, okay? Good job, brother. All done, buddy. All done.
Look at you, big boy. Good job. Oh, look at you. She's still smiling.
This is probably the easiest thing ever.
All right, thank you, Lynn, for playing that. All right, one thing that I saw in that video was kids jumping out of the car and them getting their vaccines administered in a standing position. We do not recommend this. We always recommend that you have the patient sitting down when administering an immunization or any kind of injection, as sometimes patients vasovagal, and you do not want that patient falling and injuring you or injuring themselves or anybody else around, or causing a needle stick injury because they vasovagal during the immunization. This is a screenshot of our flu season shot clinic dates, times, who the contact is, and where the locations are. This is an internal document only. Please do not give this to patients, all right? And as you can see, we're gonna have our flu clinics at Del Mar, Genesee, Otay Ranch, RB, Santee when it opens, Scripps Ranch, and Sorrento Mesa. All right, and this information will be available to you on our SharePoint website. And this was last updated on September 10th, and it will just continue to get updated as needed. All right, this is another flu shot schedule information guidelines. All right, and you can see under scheduling guidelines, during the weekdays, only 1 carload is booked every 20 minutes. And on the weekends, we have 2 carloads being booked every 20 minutes. Okay, so be sure you read through this, and you can see when scheduling the patient for the drive-up flu station, if they get scheduled, you want to make sure there are no other SRS patients in the same car who will be receiving the flu shots that same day. We want to take care of it all at once, and the patients can all be booked at the same time. Let's talk briefly about ergonomics. Ergonomics when administering vaccines. Is extremely important. We do not want you coming away injured. So as you can see from this picture, it looks like it's at a meat packing plant of this man. He's kind of like doing some sort of like yoga move here. that is probably helping him be more efficient at his job, but he's putting himself at risk for a whole host of injuries, and especially if this is done repeatedly. So I can't emphasize enough to make sure that you keep yourself safe and your body position safe. And if you cannot safely administer a vaccine to a patient in a car, then you ask them to get out and sit in the chair and put them in a position where the vaccine can safely be administered. This is the steps to the workflow for the drive-up clinic. It will start with, it'll be a collaboration between the PSR and the clinical staff. So the PSR will greet the car and verify that the appointment is scheduled. They will screen per our current COVID greeter screener protocol. They will not be allowed to proceed if they have COVID symptoms, okay, or if they've been exposed to somebody who has COVID and they're not outside of that 14-day window. The PSR will then provide the patient with the intake sheet and the questionnaire, which is age specific, either the adult or the pediatric, and they will also give them the VIS, vaccine information sheet, at that time. The clinical staff member will then greet the patient and will verify that the driver has turned off their car and removed the keys from the ignition. And I also say, put the car in park. So you're gonna ask the driver, I'm gonna have you turn off your car, put your if in park, and please remove the keys from the ignition. This keeps everyone in the car safe, and this keeps our staff safe. If you think about how many times you can get easily it is to get distracted, if you're talking to someone and not even realize that your car is still in drive and not in park, we don't want to cause any preventable injuries. The next step is that clinical staff person will review the completed intake sheet. The RN will refer to the RN specific standing orders for administration. The LVN will refer to their standing order for administration. If we have medical assistants working in the flu clinic, they have to bring the intake form to the provider and have them review and sign it. And it has to be signed on that sheet, on the intake sheet. You're then going to review allergies with the patients to ensure that there are no contraindications to them receiving the flu vaccine. You will then choose the appropriate flu vaccine to administer based on the flu grid and per the vaccine order. And then you're going to document everything. So you have to have complete documentation on that form. We talked about that earlier. You don't want anything missing. Everything has to be completely documented. Then you will instruct the patient to take a picture of their completed intake form and let them know that it can take up to 4 weeks to get a requested copy. And then instruct the driver to wait 15 minutes post-administration for monitoring. And after 15 minutes, you can discharge the patient if there are no adverse reactions. But it is important that we have the patient and the driver of the car wait a full 15 minutes before leaving. We are also going to be having employees, physicians, and volunteers coming through our flu clinics. They do not need to schedule an appointment. There is no copay. They use the same intake sheet as everyone else, but the difference is that for employees, physicians, and volunteers, when their flu shot is complete and the intake sheet has completely been filled out, then you give that back to the employee, physician, or volunteer, and they will send it to, they will give it to their manager, lead, supervisor, and they will get that flu sticker, the 2020 flu sticker that they need to put on their badge to prove that they have been given a flu vaccine this year. This is a slide with a lot of words, so I'm just going to go over over a few highlights, okay? So this is basically saying that we want to vaccinate as many as our patients to prevent the burden of the flu and also to prevent decreasing individuals' immune responses. If a patient gets the flu, they're going to be more likely to get COVID. Have a serious case of COVID because their immune system is being compromised. So we want to get as many of our members and employees vaccinated. Any patients who have regularly scheduled appointments of any type should receive the flu vaccine during their appointment. This is different this year. As I mentioned earlier, we are giving flu vaccines during specialty clinic visits. All right, we don't want to ask them to come back later. We want to get that flu vaccine on board. And it should be available in primary care, and this week it should be available in our specialty clinics as well. Okay, if they don't have a regularly scheduled appointment, they need to make an appointment, and they can do this on Follow My Health for the outdoor flu vaccination clinics. Okay. All right. Let me show you where to find the flu resources on SharePoint. For those of you that haven't accessed SharePoint before, we have a wealth of information here that is accessible to all Sharp Reed-Steely employees. We try to be as transparent as possible, and whenever there's new educational resources, we put them on our SharePoint site. So I'm going to show you how to access that. So just give me a moment. I'm going to pull up the internet. Can you guys give me a thumbs up if you can see my internet? Awesome. Thank you, guys. Okay. So what I'm going to do is I'm going to go to the training and education website. And for me, I made a bookmark. You can see right here. Very easy for me to go under my bookmarks and just click on training and education, but I'm going to show you how to get there if you don't have it bookmarked. Locations, Sharp Reed-Steely Medical Centers, click. And then I'm going to go to this left vertical toolbar here. Second to the bottom says training and education on the left-hand side. I'm going to click. And for those of you that don't have this bookmarked, I recommend you bookmarking it, and you can do that right here. You click bookmark. It tells me I already have this bookmark, so it's not going to do it again. Then no matter what page I'm on a Sharp intranet, I can go to my bookmarks and quickly get to training and education. All right, we have two tiles here for you to choose from. The first one is staff resources. That's the kangaroos. And below that, this is our competency website. So when it comes to clinical competency time, we have lots of resources for you right here. You can click on there. You can actually click on it year round, and all of our PowerPoint modules are accessible to you along with our skills criteria. But we want to go here for staff resources. Click on staff resources, and it's going to open up the home page. And we have a lot of information in here for you to look at when you have a free moment. But for today, we are going to go down, scroll down to right here with a Band-Aid. It's that time again, flu shots are in. So you're going to click on here. And it will take you to this site. And we have two categories. I'm going to go under this category 1, general flu season information. Here's what I have for you guys here. I have the PowerPoint for the 2020 flu clinic. Okay, that will be today's PowerPoint. The most up-to-date one is here. And then above that, we have a link to the CDC influenza information. We have the consent to treat a minor is here. And then right here, I'm going to open this document. This is frequently asked questions. So we keep this updated when questions come in about the flu clinic. This is where we put the answers. So if you have a question and we say we'll get back to you, this is where we're going to post the answers. That way everybody will have access to the answers to your questions, because if you have a question, many other people do as well. Okay? Basically, a lot of information in here for you guys. I like this one down here. This is a good question. For children that need a booster shot, can one be a flu mist and one be IM? I would have had to ask that, but I look right here. Yes, mix and match are allowed. Okay, can employees go through the drive-through clinics? We request they do not take up these spaces. However, their family can go through the drive-up vaccination stations. And if you're in the car, you can get one as well. All right, so that's where you'll find that information. Let me close out of here. And then we have this other category, which is unassigned, and you will find a whole host of other information. Right here, we had a question about flu cooler storage. It's right here. All right, this is the instructions for you right here. Okay, we have the fridge log. We have the standing orders. And as you can see, we have the VIS, okay, for the inactivated injection, and then also for the live flu mist. All right, so everything that you need should be found here on SharePoint. All right, that is not for anybody here. We're going to go ahead and answer questions if you have questions, and then I'm going to have you guys take a survey, and you're going to do it two ways. One, you can turn your camera on, all right, and hold it up to the QR code. It will scan it and ask you to open up a link, and I'll take you right to the survey. The survey today, your instructor, and I believe, they're going to be under Meg Murphy or Meg McDowell. You just look for Meg. I'm the only one in there. It'll be Murphy or McDowell. Either one is fine. And then Lynn Maisha was also on today, so you can click her as well. And then answer the questions. You'll put in today's date and the name of today's class, as you can see at the bottom, SRS Flu Clinic Training Class. What I'm going to do next is I'm going to put this link up here in the chat box. I'm going to take this out of slideshow mode to do that. I'll copy it and paste it into the chat box. So if you are not able to use the QR code, then just click on the link in the chat box and you'll be able to do that. And while people are doing this, I am available to answer questions. I just need to do that copy and paste. All right, so I just copied that into the link, into the chat box with the link. Does anybody have any questions? We did finish early. It's only 3:07 and we were scheduled to go until 4. And this is your opportunity to ask questions. Right, well, I want to thank everybody for joining us today for your flu clinic training. If at any times you have questions, feel free to, first of all, look in the frequently asked questions. And if you don't have an answer, you can ask your supervisor or lead. And if they don't know, feel free to email the SRS Training and Education mailbox. And that's usually the best way to get a hold of us, is to use our mailbox. because it's monitored every day, whereas some of us are not here 5 days a week. So if you email us, you're welcome to email me individually, but I'm here 3 days a week. So if you email me on those other 2 days, I may not respond right away. That is why we recommend emailing the SRS RN Training and Education mailbox. And then Miriam. Hi, Miriam. I see you have a question about dress code for staff. Typically, it is recommended that you wear scrubs with closed-toe shoes. However, you can also ask you, if that is not your normal dress code, because you work in a specialty area, then please just ask your supervisor what you should be wearing. Personally, if I'm going to be interacting with patients during the COVID pandemic, I like to have, even though it's not my typical dress code, I do like to have scrubs on just because it makes it really easy when I get home just to throw all of that stuff in the wash and not accidentally contaminate my family. All right, thank you everybody. It was a pleasure having you all on today. And I'll just stay on a couple more minutes in case anybody has questions.
Thank you.
Thank you.
For some reason, I'm not able to grab that link or that QR code. Is there a way you can email us the link?
Yes, who's talking?
Robin.
Robin, let me just, I can email that to you real quick.
Thank you.
If anybody else is having an issue, just let me know.
Yes, Barbara Smith.
Okay, give me one moment here. Okay. Is it Barbara G. Smith?
Yes.
Okay, I have you in here. Okay. Anybody else? Oh, and Helen, you asked me if we can have the PowerPoints emailed to us. We're not emailing the PowerPoints. It's located where I showed you on SharePoint. So you can pull it up on SharePoint at any time. And that way you get the latest PowerPoint, because we do update the PowerPoint when there's changes. Okay, I just sent that email to those of you who asked me for it.
Thank you. All right, I'm gonna go. Have a nice day. Thank
All right, thanks for coming on, Robin. Take care.
Thanks.
Good luck, everybody. Everybody stay safe out there.